Do you want to know how to help a child with ADHD without medication? Well, I've done it. I'm Nicolene Peck. I'm a parenting expert and communications expert. And in this video, we're going to be talking about what you can do for your ADHD child and not include medication. In this video, I'm going to share some of my experiences working with children with ADHD, and I'm going to share with you some things that you can do to help your child with ADHD feel more confident and happy and have less anxiety in their lives. Years ago, when I was a young mother and I had just toddlers of my own, my husband and I decided that we would do treatment foster care for troubled teens. So we brought teens in our home between the ages of 12 and 18 years old, and many of them had ADHD. Now, this meant that they had higher anxiety oftentimes, they had a harder time focusing, sometimes they were a little bit more wild than other children, sometimes they struggled with boundary issues and such. You know the drill. But one thing that I noticed with all of the children that came into my home was they all came on different medications. So that was just part of the way they were when they came. And I thought to myself, do they really need all of these medications? Now, maybe for some children with ADHD, the answer might be yes, they do. But I felt like for years, these children had just gone to psychiatrist's office and they'd been adjusting medications to try to solve their behavioral problems forever without ever actually doing any behavior training. It's very important to add training to any behavior modification. Now, I teach self-government. Self-government is all about changing a person's heart or helping a person choose to have a change of heart, as well as having a change in behavior. So I wanted something even more than a change of behavior for the foster children that I was working with. I wanted them to have a heart shift for the rest of their lives and to know that they were capable of controlling themselves. So I decided that my goal, it was kind of a secret goal, but my goal was to help the children get off of all of their medications if possible and just teach them the skills that they needed in order to live happy, productive, and in control lives. I remember one of my first foster daughters that came to my home. She said, "I hate that I have to take all this medication. I wish I didn't need to. I feel like I'm so broken. Am I going to have to be on this for the rest of my life?" And I felt bad for her. I thought, that's a good point. Unless it's really necessary, do you really have to be on it? Now, I do know sometimes it is necessary, but I also know sometimes we over-medicate our children these days. Back in the old days when a 7-year-old boy was active, couldn't stay in his chair very well, had a hard time paying attention, everyone said, well, there's an active 7-year-old boy. And nowadays, people think because the 7-year-old boy doesn't act on cue, he might need to be medicated. And they give him a label sometimes of ADHD. Now, maybe he has it, maybe he doesn't, but the solution is the same. So let's talk about what that solution is. I'm going to share with you some of the nuts and bolts of teaching self-government. So teaching self-government is a type of parenting where you create an environment where a person learns self-mastery. Now, I want to warn you, when I do a self-government training for couples, it is a 3-day event. My Teaching Self-Government Parenting course has 20 hours of training on it. So this little bit is going to be a very tiny piece of the puzzle that you'll need, but I do think it will help get you started. The first thing that your children need to know is they need to know that you have the parental authority, that you're the teacher, that you're the leader, that you're the one that instructs, and they are the ones that follow instructions. They are the ones that have to learn. They are the learners. That is their role. It's so important that our children learn their roles. In fact, as part of my Teaching Self-Government program, I actually recognized that many families were having a problem understanding each other's roles. And because of this, I actually created a book called Roles, The Secret to Family, Business, and Social Success. In this book, Roles, there is a family who seems to have a hard time bonding, getting along with each other, and they get distracted a lot. So maybe some of their children could even be perceived as having ADHD. But we didn't make that clear in the book. What you do see, though, is you see the family understanding and acknowledging who each other is in the family to each other and taking responsibility based on their roles. There's a young woman that I work with, and she has ADHD. Very obviously a traditional case of ADHD. She has a hard time focusing. There's a lot of loud outbursts that happen. She's fidgeting a lot. She gets bored very easily. She talks out of turn, all of those kinds of things. But this particular girl also knows who she is. With her parents, she knows who she is. She knows who she is as a sister to her siblings. She understands her role. This makes a big difference in her life. In fact, there was a time when I know she didn't understand her role as well. And the more that she gained an understanding of who she really was to the people around her, the better her behavior came. So I know it seems like that can't be one of the main solutions, but it absolutely is. If the child does not understand who you are and who they are, then they will continually act out and not focus on following your leadership. For all the children that came to my home who had ADHD, we tried to keep things simple. That's important because you have a hard time focusing when you have ADHD, right? So you can't have things very complex. You've got to make sure that you can keep track of the list of items you need to do. So that means the list needs to not be too long and it needs to be very predictable. So we taught them skills. We taught them 4 basic skills that they would need for success in our home. These 4 basic skills are taught in a set of children's books that I have. These children's books each teach one of the 4 basic skills. The red one teaches following instructions. The green one teaches accepting no answers and criticism. The blue one teaches accepting consequences. And the purple one teaches disagreeing appropriately. These skills are also taught in my Teaching Self-Government Parenting course. If a person learns all 4 of these 4 basic skills, it actually takes care of 99% of their behavioral problems. So each of these 4 basic skills has a skill set attached to it. Now I know that seems complex, but it's actually simple for children because it's a repeated list of things that are very intuitive and they're always used together. So it's very predictable. It doesn't shift or alter based on different circumstances. In fact, it's one skill that you can use in lots of different circumstances. For instance, the steps to accepting a no answer are to look at the person, keep a calm face, voice, and body, say okay or ask to disagree appropriately, and then drop the subject. Those 4 things naturally follow each other when a person is self-governed. Do you like this information about ADHD? Well, then give this page a like, and then let's move on to our next steps. So we keep it simple. These skill sets for the 4 basic skills keep things very simple. I also keep the way I correct my children very predictable. So it is important that children with ADHD are consistently corrected. This means we don't give them allowances for their behavior that goes off base. We have to correct it. If there's one mistake I see parents make with children with ADHD, it's going, well, they have ADHD, so that's just how they are, I don't have to correct it. This is not a good idea. Correct it. Even with a toddler, you correct it. And their prefrontal cortexes are very small and their life experiences are very few, but you still correct it, right? So that you don't have a problem in the future. The sooner you correct something with any person, no matter how they process, the better. Because then they can form good habits. So don't let the bad habits go. Don't take them personally, because it's not worth that. But definitely correct them. In fact, calmly correcting them can be just the thing that helps them recognize they've got to work on correcting them themselves. If you consistently correct them and they get the opportunity to accept their negative consequences and those corrections on a regular basis, then they will soon be giving themselves corrections before you even get the opportunity to. And that, after all, is what it means to be self-governed. So whether your child is on medication or not on medication, whether they even have ADHD or not, these principles can have lasting change to help your child and your whole family have more self-government, which leads to family unity and increased bonding. So if you've enjoyed this video, I have more for you. There's a free class that I would like to give with you in the next video. It's called The Expectation Trap versus the Cycle for Success. Go there and learn how to stop your family from getting trapped by the expectation trap and increase your family problem-solving skills. Click on the link now and I'll see you there.